Now, losing an average of between 100 and 150 strands of hair per day is a normal amount of hair loss, they tell me. But what happens when you begin to lose more? It can really affect and impact your self-esteem and confidence.
Yes, so today we're getting lots of advice from Boots pharmacist Paula Reilly. She is going to tell us about, I suppose, the factors that contribute to hair loss, but also what you can do to help prevent it and stop it. Hello, Paula.
Hello.
Good to see you, Paula.
You too.
It's an issue that we often associate with men, but it's also an issue for women when it comes to hair loss. I suppose the first thing to do is, I guess it's hereditary, but also there are factors outside our control that can cause hair loss.
Yeah, so it can equally happen men and women, and it can be extremely distressing for anyone when it does occur. But there's loads of factors that can actually contribute to hair loss and cause hair loss.
Yeah, I was surprised before all that to find out that if you lose between 100 and 150 every day, that's normal. Is that for men and women, though?
Yeah, in general, that is the norm. So I suppose women are going to notice it more because they have longer hair, so they'll see it more. Men probably won't notice it as much, but that would be the normal amount.
I would totally notice if I brush my hair,
you?
though, loads.
Would you?
I would, yeah.
Every day?
Well, no, especially if I'm kind of in the shower and I'm getting conditioner through it, you would, yeah. But if you have more hair.
To point out that is normal. A lot of people would come into the pharmacy panicking, thinking that actually
totally normal.
Yeah, it is normal.
Does that start at any age, or are you losing that amount
whole
of hair?
time.
All the time?
Yeah. Yeah, just men wouldn't notice it as much.
Yeah, so that's the thing.
When your hair is shorter. But let's talk about, I suppose, male hair loss. And is it, I suppose, hereditary or genetic when it comes to men?
Yeah, so there is male pattern baldness, I suppose, that people are more aware about. And that can be a combination of hereditary factors, but also hormonal factors as well.
Yeah.
And can really happen anytime from puberty onwards. Now, you can get female pattern baldness as well, but generally you don't see that until over the age of 40 or past the menopause. But it can happen much younger in men.
Yeah, and you can really look at your family and you kind of nearly can judge whether you will actually lose your hair or not.
Apparently it's to do with your mother's side or
it's
something.
Your mother's side, yes,
yeah.
But it can also be, I think, on the male side with...
Absolutely. So there is essentially a myth out there that just on the female side, but that's not the case.
It's on the male side too.
My father's crowd had the best head of hair ever, right?
Yes.
And my mother... They're all a shower of baldies.
Well, then that's it then.
Sorry,
good night,
if you're watching the show, yes.
But it is true. It's on the female side as well. Okay.
Yeah, it's not just one side.
Outside of all that, then again, you have other stuff that can contribute, like stress.
Yeah, there's loads of other factors. So any kind of shock to your body at all. So it may be psychological stress. It may be any kind of trauma. Maybe you've had surgery. Even after childbirth, for example, a lot of women would come in and say that they're shedding a lot more hair than normal. Or any dramatic weight loss. Any kind of shock to the body. Now, you may not notice it till about 3 months after that shock has occurred, but then you will see a lot of excess shedding of the hair.
A lot of women will notice after pregnancy, after they've had their child, that there's an awful lot of hair loss around here, and almost that baby hair look. Would that be normal?
That is normal, and it can be, again, very distressing for people. What I will say is generally that is temporary. It will start to grow again, so I wouldn't be overly concerned, and there isn't any major treatment that a person in that situation needs.
Okay.
If you're on certain type of medicine as well, I believe, Paul.
Yeah, there are.
Factors,
there's certain medications, and there's also certain underlying medical conditions that can cause hair loss. And that's important to know, because it is important to identify what the cause of your hair loss is to ensure that you get the most appropriate treatment for it.
Okay, there are certain treatments you can get in a pharmacist, and maybe that's the place to start. Let's take us through these. Let's start with Regain. God, it's funny. I remember that for men, but now there's Regain for women.
Yeah, so that can be used for both men and women. So that particular one is for hereditary hair loss. So for male pattern baldness, there's 2 products there. So there's a solution there that you massage into the scalp. So you use it twice a day. And also then there's a mousse there or a foam that you can apply directly to the scalp also.
How long will it take for that to work?
That's a very good question, because some people want, I suppose, an overnight miracle cure.
It like one of the Jackson 5 straight away. It doesn't work like that.
It doesn't work like that. It could take 6 months to a year before you're going to notice any improvements. And also to point, once you stop using that, the hair loss will continue. So a product like Regain does need to be used continuously in order to stop the hair loss.
Does it work via stimulants? Is that how that works? It stimulates hair growth?
It does. It stimulates blood flow to the hair follicles. Yeah, it increases the hair shaft and increases the growing phase of the hair as well.
No, if you're entirely bald, is that too late?
The answer is no, it won't work.
But when should you start using it, I suppose, Paul?
As soon as you start noticing symptoms of hair loss or of that male pattern baldness or female pattern baldness, you should be using this treatment.
Once the beach starts getting bigger.
Yeah, because as I said, that is just going to stop and slow down the hair loss. There may be minimal hair growth, but it's not going to do anything later on.
That's good, at least. Beside that, is that a shampoo?
Yeah, so there are loads of other products as well. The one I have here is a herbal-based shampoo if you're looking for something alternative. Again, it will stimulate hair growth. and help minimise hair loss. But again, it's important to make sure you know what's causing the hair loss to see if this is going to actually work and be suitable for you.
Of course, diet can have a big impact on, of course, any part of your body, including your hair as well, including stimulation of hair. So you've got a number of, I suppose, supplements here.
Yeah, so I suppose the hair, you know, it's a tissue like it needs nutrients like any other tissues or organs in the body. So there are supplements that you can get that will help.
Biotin, Paula, that's a mineral, isn't it? The first one there.
Yes, so we have most of these products, actually, the supplements there will contain biotin in them as well, and that will just stimulate, again, just making sure your hair is completely nourished when it is growing back and making sure you're taking care of your hair.
Okay, and beside that you've got imidine, and I'd often associate that with skin, but this is also specifically for hair and nails.
Yeah, this is another one. So they have a range of products, obviously, but this particular one is for hair and nails. And again, it's good for kind of just promoting healthy hair and healthy nails.
Because keratin in your hair is a protein. That's what you're trying to stimulate, really, isn't it?
Yeah, and I guess the problem is as well, a lot of people are on restricted diets at the moment, and they may be limiting certain minerals and certain, you know, food groups, and actually that can cause a problem. If you're on a really strict diet, then that could be causing your hair loss as well.
Viviscal, I think people will be very familiar with this, I suppose, Paul. It's a global company, I think.
Product,
Yeah, absolutely. And again, is maybe a suitable product for you, depending obviously on what's causing it. So I wouldn't rule out, you know, getting blood tests done and seeing what the cause of it is, but these absolutely could be suitable to help you.
Because Viviscal would have a lot of marine minerals, and that would be the basis to that. Yeah,
that's right.
So what do you have beside it there in the corner then?
So the last product there is a cosmetic more so than anything else. What that is, it contains keratin fibres, which actually merge with the hair and just make the hair look more volumized and bigger as such. So it's more cosmetic based. It's not going to treat any underlying cause at all, but it will help in terms of the appearance and making exactly. And there are plenty of other products like that out there as well.
I suppose one thing we're saying today, Paul, is you shouldn't suffer in silence, really, because as I said in the beginning there, it'll affect your self-esteem, your confidence, particularly if you're meeting people, if that's your job and stuff.
Yeah, and a lot of people are embarrassed about it, don't want to talk about it, and maybe, you know, don't think there's anything out there to help them. So what I would say is definitely go into your pharmacist, speak to your pharmacist. They may refer you to your GP. There are items that you can get on prescription also, so this isn't just solely the range. There are other options that are out there as well.
And what about seeing a trichologist who looks specifically at hair?
Oh, I mean, I wouldn't rule anything out. Absolutely. I mean, there's plenty of options out there and support.
But start
for you
with something, then go to your GP. I suppose, as you said, find out what the cause is, because you can't deal with it, you can't treat it without knowing what the cause is. Paula, thank you very much.
No problem.
Thank you a lot. Now, for more information on all those hair products that we discussed there, you can pop onto boots.ie or go in and see Paula in the pharmacist. She'll be happy to help you.
No problem.
No problem.